Hello everyone, I'm Nahla Hamouda from the College of Pharmacy at American University. First, I want to remind you again about a very important question as a pharmacist you should ask to your female patients before prescribing her any drug. Please ask her, are you pregnant or expecting pregnancy, or are you a lactating mother? Please don't be shy to ask your female patients, these questions because it can be life-saving for her fetus. Okay, so in the last video, we talked about describing what is a teratogen or teratogenic agent. Teratogen is any agent that results in structure or functional abnormality in the fetus or in the child after birth as a consequence of maternal exposure during pregnancy. For example, if the mother took certain drugs which is a teratogenic, so during the development of the baby in her uterus, some structure abnormalities, it means defect in the organ development, can happen in her baby. Or functional abnormality, it means after the child is born, they discover some abnormality in the function of the heart or the liver or any organ. These abnormalities are due to the teratogenic agent. What is teratogenicity? It is the ability of any drug to cause any fetal abnormalities when given to a pregnant mother. This is the effect of the drug. We say it's the teratogenicity. Drugs can affect the fetus in 3 stages. First, the stage of fertilization and implantation, which is usually the first 2 weeks of age intrauterine. The stage of organogenesis, which is the time for development and synthesis, formation of the organs inside the fetus. And this stage is the most dangerous. Stage 3, which is the stage of growth and development, growing up of the body organs. To make it more simple, let's see here the effect of the teratogenic drugs. As you can see here, the first 2 weeks, which is the stage number 1, and then from week 2 to week 8, which is stage number 2, organogenesis, and stage number 3, which is the stage of organ development. What happens if a mother took a teratogenic agent during each stage? First, in the first 2 weeks, prenatal death could happen. It means death of the fertilized ova. The mother loses her fertilized ova. What happens due to the 2nd or 8 weeks? Major morphologic abnormalities could occur. Let us first describe and understand what is the meaning of major morphologic abnormality. Major, it means very big, not a minor one. It's a major defect. Morphology means the appearance. So morphologic means the structure or appearance of the baby body. For example, there is no hand, there is no leg, there is absence of one eye. This is a major morphologic abnormality. Because this age from the 2 to 8 weeks is the most dangerous and the duration of development of the organs of the baby. And during the 3rd stage, we can have physiologic defects and minor morphologic abnormalities. It means the morphology may be normal, but the functional or the physiology of the internal organs may have some defects. I want you to remember from this slide, the most important and dangerous period is from the 2 to 8 weeks. The teratogenic agent can have a very big effect during the 2 to 8 weeks. It's better not to give any kind of drug to the pregnant female during this time, from the 2 to 8 weeks. Please don't forget this number. So, because giving drugs to the mother is a major problem, the FDA had classified the teratogenic agents or the drugs into 5 categories. First, category A. These drugs had adequate studies in humans and it showed no risk of any teratogenicity. Unfortunately, these drugs are very good for the mother. In the pregnant mother, she always needs supplements of vitamin D and folic acid for the good growth of her baby. So these 2 drugs, they are very safe. I think they are the only proved drugs to be very safe. Category B. Here, some animal studies showed some adverse effects, but no studies in humans had showed any risk. But some animal studies showed adverse effects. These drugs like paracetamol and penicillin. And you should always say to your female patients, if you feel pain, you want to take any analgesics, please only take the paracetamol. It is the safest during pregnancy. Category C, the animal studies showed some adverse effects, but the human studies has not been done or performed. So, before prescribing these drugs, we should think about the risk-benefit ratio. What does it mean, the risk-benefit ratio? It means, when I give the drugs to this mother, does she have a severe condition? If she has a severe condition which may endanger her life or her baby's life, okay, I have to protect the mother. So I have to give her these drugs. But if the disease in the mother is not so severe, not affecting her life, so we can think, maybe we should not give her the drug for more safety. Okay? Category D, there has been an evidence of human fetal risk, like aminoglycosides. They are a very common group of antibiotics, but they are very known to have ototoxicity and nephrotoxicity in the baby. They affect the development of the ear and hearing system and the kidney. Category X, they are confirmed to have adverse effects in animals and humans. The risk always exceeds the benefit, like anti-cancer drugs. Of course, we should not give any pregnant mother an anti-cancer drug. Okay, again, I want to remind you about the most dangerous time for exposure to any drug from the 2 to 8 weeks of gestation. As you can see here, it's the time for development of the main body organs like the heart and the skin. What is the mechanism of teratogenicity? Drugs can have many mechanisms, like interfere with the genetics, gene mutation, break down the chromosomes, interfere with the cell function, inhibit the enzymes, and alter the membrane characteristics. What is the end result? Failure of cell-to-cell interaction. The cells fail to grow, interference with the cell migration, and mechanical cell disruption, it means bursting of the cells. So all these effects will lead to defective formation and development of the baby organs. I would like to show you this photo. It's very important, and I don't want you to forget this photo. As you can see, there is a major abnormalities, morphological abnormalities in the babies. It is a condition called Phocomelia, which is the malformation of the 4 limbs, both the arms and the feet and the thighs. All the 4 limbs are defective. That was due to a drug. Now it's completely withdrawn from the market is called thalidomide. That drug was not effectively tried in the population. So when they started to give to pregnant mothers, they were shocked that all the babies born to the mothers who had ingested thalidomide had Phocomelia. It's very sad to see many babies having this condition. So please, I wanted to show you this picture to make sure that you don't forget about this condition. Okay, so for us at the pharmacy, what are the guidelines for prescribing drugs in pregnancy? First, generally, using of drugs is generally contraindicated. It means it should not be given unless it is severely necessary. Only few drugs are considered safe, as I said, like vitamin B12 and folic acid supplements. Don't use drugs unless it is absolutely necessary. It means not giving the drug is dangerous for the life of the mother. Prescribing in pregnancy, as I said, is a balance between the risk-benefit ratio and the risk of adverse drug reactions in the fetus and the risk of leaving the maternal disease untreated. We always have to think, is it better we avoid giving the mother a drug or we must give her a drug for the sake of her life? Also, please remember that the baby is very sensitive during the first trimester and especially the 2nd to 8 weeks. Use the tried and tested drug whenever possible in preference to new agents. We always say all the drugs are safer than new drugs. Use the lower than usual dose for the shortest period of time. And rule out possibility of pregnancy in every female of the reproductive age group and restrict drug usage. Again, please ask your female patients 2 questions. Are you pregnant or expecting pregnancy, or are you a lactating mother? And also, we should change the type of drugs in some cases. For example, if a female has a disease like diabetes and then she's pregnant, she can no longer take any oral antidiabetic drugs. Only insulin is allowed during pregnancy. All antidiabetic drugs, they are teratogenic. And please remember, always advise your patient about the risk of smoking, alcohol, OTC drugs, and the drugs of abuse. And the golden advice, please ask the mother or the female to read the label and check if there is any contraindication for taking these drugs during pregnancy. Okay, thank you so much.